And as promised, 35 experts or 35 different industries, experts from every industry, talking about the challenges, the hardship, and the opportunities, especially in these hard times. Today, long-term care and a conversation with Kim Tweedel. Kim, thank you for joining us. Welcome to the show.
Well, thank you for having me.
We've got a good lineup the rest of the week. We've got fitness at home health care. We also have, health industry, the health experts. There was a big storm in Houston. So on Tuesday, we're going to have Brian talk about how to check your house for hail damage, how to check your roof. So tune in 9:35 live, Expert35. If you want to join in the conversation, text Expert35 to the phone number on the screen, and you'll be able to get all of how to join, how to follow us. Of course, today we've got Kim Tweedel. Now, you are expert number 16. So if they text expert 16, you'll be able to talk to Kim and be able to get all her contact info. Kim, thank you for joining us. Thank you for being available today in these hard times. And how have you been?
I've been good. I'm surviving.
Mm-hmm. And tell us a little bit about your background. So you're, elderly aging in place expert. What exactly does that mean?
Okay. Well, I own a caregiving agency, but my background is respiratory therapy. I worked in the hospital for years and as a respiratory therapist, and I ran a durable medical equipment company. I also used to take care of ventilator patients in the home, remotely in the home. And I did that for several years. So I have a health background, and I've been in business now for 10 years. This is our 10th, ending our 10th year. We'll be going into our 11th year.
And you provide
elderly at home, taking care of the elderly at home.
Okay, and so you have staff and you have people that go to the different homes, right?
Yes. We have what we call caregivers. Basically, is how you refer to them as caregivers that go into the home and take care of people that are trying to age in place.
Excellent. And some of these people are nurses. Some of them are not. Like, there's different levels. Like, what does it mean?
There's not really. They're not. Some of them are called certified nursing assistants, CNAs. Mm-hmm. Some are just caregivers that are people that have done this for years. They have the compassion, and they love what they're doing. We've had some very interesting experience with hiring people that never have done it before and have turned out to be the best caregivers. You can teach the skills, but you can't teach the compassion and empathy. And if they have a compassion and empathy, more than likely they can become very good caregivers.
Wow, excellent. So obviously these are difficult times, and people are asking, how do we adjust? Families are disconnected. And what is the number one worry you're seeing among families and, taking care of the elderly?
Well, it's very similar to before this happened, where people lived in a different state and trying to worry about their parents. Now, people living here cannot get to their parents. They're scared. They don't want to go in and, expose them, or their parents or the loved ones are in a facility where they pretty much have locked out anybody coming in. So they're worried about them contracting the COVID-19 or just being lonely. Some of them are just lonely. There's no, they don't have any interaction with people anymore. They're sequestered to their rooms or their houses. So it's very concerning to people, and what this is going to do, probably also to the aging process to that person. It's just going to make them more stressful and cut into the time they have left with them.
Right. Actually, we've got a couple of people from the audience asking some questions. One is that they're worried about having a stranger in their house during COVID-19. How can they be sure the caregiver is being safe or even properly trained?
Okay. Well, this is, I would highly suggest going with a reputable agency that can prove to you that they are training the caregivers on the COVID-19, that they have the proper equipment and masks and gloves and so forth. Reputable agencies, home care agencies should do background checks, screenings, reference checks of everybody that goes in, and do a lot of supervisory visits, calling and checking in. with things going on right now, a lot of stuff is done with FaceTime. We're using FaceTime more than we've ever with caregivers and clients to just do checks. If somebody's really scared when somebody comes in, I highly suggest get a camera, have a camera installed.
And we got a question from Jana. She's saying, are you recommending that people remove their aging parents from senior living homes?
Well, that's a struggle a lot of people have. To be honest, if it was my parents, I probably would take them out just because it's spreading, and when you're that close and that close with people, it's showing now. It spreads very easily. But not everybody can do it. Not everybody's set up, equipped to do it. You need to make sure you're equipped. If you want to remove them, make sure you have something in place to help take care of them. People, either friends, other family, and you have the gloves and the what they call PPE to be able to take care of them.
And if you take them out, you probably practice even some isolation within your home, right?
Exactly.
In that time? Okay.
Exactly. If somebody's going out to work in that home, you're bringing them home. Say your he's got an essential job and he's going out. I would keep them separate. Not eat at the same table, not use the same restroom. You can social interact with, they said, the 6 feet, but not share plates. One of the things you want to do is keep separate silverware, dishes for your parent or your loved one that's staying in your home, separate from everybody else. Wash the clothes separate. Make sure you do have the cleaning supplies, like bleach or Clorox, and anti-fungus disinfectants, and if you especially keep a bathroom separate for them from the rest of the family.
I've got another question from Jennifer Johnson. She says, what special precautions is your staff taking? So tell us a little bit about Advocates for the Independent. So that's your agency, right?
Yes. What we've done is we've put them through a COVID-19 training. Everybody has masks. They're required to wear a mask regardless if the client, I guess now that this is going to be a rule, you're going to have to wear a mask. But we have in the beginning secured masks and gloves and sanitizer for them to use going into the client's house. So they're washing their hands. They're using the sanitizers. They're wearing the mask. They're staying in. Some of our clients there's a lot of personal care, which, bathing, dressing, helping them transfer. So you can't keep that 6 feet rule distance. So what we're trying to do is limit that amount, make sure that they're, that the client, gets what they need, but try not to hover over them too much and give them space.
Right.
And each client, we do check daily with the caregivers to see if they have fever, any symptoms, if they're feeling, or if they feel like they've been exposed. If they have been exposed, we had one caregiver living with her sister who was an RN working at one of the hospitals that came down with it. We did not let her work. She had to stay home for 2 weeks before she was able to come back.
And that's good to even check for those things, right? Another really quick question, I think there's an important one, is that what are agencies? Are they government funded? Are they private? Like, I guess you keep saying you're an agency, right? So what exactly does that mean for somebody that's possibly looking to, work with somebody like you?
Okay. Well, for in Texas, we're considered home health agency with a personal assistant service license, which is different than home health skilled. They consider us custodial services, where you have a skilled agency, has an RN of physical therapy, speech therapy, occupational therapy. That's a certain license under home health, and we're personal care, person assistance services. Government or Medicare does not pay for us. They pay for the skilled part. The only thing it pays for the home care agencies personal assistant services is long-term care insurance, and the VA has an aid and attendance benefit program, which is separate from going down to the VA. But there is some agencies that are funded through some Medicaid programs. We
And this is
don't
probably
do
a
it.
good segue. Let's go into those resources, right? Can you talk a little bit about some of the resources that are available?
Okay, well, like I said, we are private pay, and agencies like myself are
Hmm.
private pay with, and then of course, long-term care and there's some aid and attendance benefits. But if somebody does not have the money,
Hmm.
it's basically kind of a Medicaid thing. There is some state programs, waiver programs, that you can go to the Health and Human Services, and they will come in with a case manager, evaluate the situation. They look at all your finances, and then they can send out caregivers. But people need to be aware, if they own a house, and they do tell them if they're going to pay for the caregiver to come in, but if you have any type of property, when you pass away, they garnish it and take to get some of their money back. But
Okay.
a lot of times people just don't have any resources, and they can send out caregivers through different agencies. There's different agencies that do the program. Unfortunately, I do not do it for a number of reasons, but there is agency. If we have people that call us that really don't have the funds, I do try to help get them set up with the state, so the state can come in and help them. We will help them, put them in a contact with somebody that can help them if they don't have the funds.
Perfect. And one of my favorite parts of the show is 3 things people need to start doing right now, right? So what are 3 things people need to do if they're going to be transitioning?
If they're going to be transitioning to care in the home, um, they need to talk to their parents, their loved ones, and have a conversation with them. A lot of times, people are scared of bringing somebody into the home, especially with the virus. They're afraid somebody's going to bring it in. So, but you need to have a conversation with them and explain to them, a reputable home care agency does all the training and the screening and the background checks of the caregivers that go in. Um, that's one thing to get them used to, but to set their mind at ease.
Hmm.
Um, they need to, look at what's going on with their parents, and talk to the agency, and have the discussion, where they're lacking. Sometimes people are forgetting to take medication. Sometimes bills are piling up. Um, or their house is really dirty, or they can't even get into a shower by themselves. So
Right.
look at those type of things, and then really look at, you can hire privately. I put together something a while back where it's kind of pros and cons going through an agency, going privately, and that's something you have to look at and yourself, whether you really want, how you want to do it. But there's pros and cons to both. But investigate the agency, ask
Hmm.
for referral services. I also have a list of things you want to ask when you're hiring an agency, um, and talk to a couple of agencies and go with your gut feeling. I mean, you can talk to references. Nobody's probably going to give you a bad reference, but it's
Right.
just like the same thing in a job thing. But
Well,
if you,
and we're going to put all these things in the notes. If you text expert16, which is Kim Tweedel, you will actually get those resources, and you have a checklist, right? Like questions to ask an agency,
correct.
right?
Yes.
And I mean, and you've been in this industry for a long time. How long have you been doing this?
10 years this
10
year.
years. And this is I'm going to throw this question. Normally we don't take questions at the end, but do you take insurance? Jennifer Johnson wants to know, do you guys take insurance?
If you have long-term care insurance,
Hmm.
and that's it, your regular Medicare, your regular Blue Cross Blue Shield, they don't pay for this type of service. It has to be a long-term care policy. And we do take assignment on. We will bill the insurance for you and then only bill you what they don't pay.
Right.
Um, but yes, unfortunately, regular insurance and Medicare does not pay for this service.
Man, Kim, such an interesting conversation with you. Such good insight, and I think the biggest takeaway is that, like, don't do it alone, right? We're under so much pressure right now.
Exactly. Exactly. Here's a known fact. The caregiver, being the family caregiver, the wife, the children, sometimes will end up passing or becoming very ill just from the stress of trying to take care of their loved one. And there's statistics that prove that.
Hmm.
So you do need to reach out for help. You need to either reach out through friends, family, your church, or hire a home care agency or hire private. Get some help because you cannot do it alone. You will put yourself in the hospital.
Yeah, we're under so much pressure. We're wearing so many hats. We're parents, we're teachers, we're taking care of the house, and now have parents on top of that.
Yes.
Those were super timely. Uh, Again, Kim, thank you so much for making time for Expert 35. It's great having you on the show.
Well, thank you for having me. I appreciate it.
And thank you for keeping everybody safe. And again, if you want to reach out to Kim, she'll be all the information is going to be on the notes. Text Expert 16 and you'll get all her information. Guys, thank you for joining us on Expert 35 with Kim Tweedel.
Thank you.